Hi class, my name is Andrea Pacheco, and the topic for my research proposal was suicidality in individuals with comorbid post-traumatic stress disorder and obsessive compulsive disorder. More specifically, the question that I want to research is if interventions for patients with comorbid PTSD and OCD decrease suicidality, and if so, how does the age of onset impact the intervention strategies? So there is no specific traumatic event or PTSD diagnosis that increases the comorbidity of OCD. And the diagnosis of PTSD alone is enough to increase the risk of developing OCD. So Rains 2019 discussed that OCD may emerge after a traumatic event because the individual has a difficult time adjusting and developing and using positive coping mechanisms. So individually, PTSD and OCD can negatively impact the individual's physical, mental, and interpersonal health. When combined, they have overlapping symptoms that increase the impacts of those symptoms on the individual's well-being. 2018 states that the comorbidity of these disorders decrease the functional health in the psychological domains of the individual, thus increasing suicidality because it is affecting emotional well-being, energy, fatigue, pain, and more. The purpose of this research proposal is to improve intervention methods for this specific population to decrease suicidality. The null hypothesis was no significant correlation between interventions and suicidality for this population. The researchers' hypothesis was that adjustments to interventions will decrease suicidality for this population. It may be difficult to find a large enough sample to have significant results, but the sample would have to consist of individuals with comorbid PTSD and OCD. It would also have to exclude individuals who have been diagnosed with any other disorders or illnesses, because the focus of this study is on the specific population of individuals with comorbid PTSD and OCD. Recruitment would be made through media, newspaper, and other local sources. And the proposed study would be a between groups design that is only post-tests to see the impact of cognitive behavioral therapy. The participants in the sample will be randomly selected into two groups where one group receives the cognitive behavioral intervention and the other group will not. Afterwards, the Beck's Depression Inventory, or the BDI, will be the instrument that will be used to measure depressive symptoms of the sample population. The assessment will show if the intervention was successful at decreasing suicidality because the BDI assesses depressive symptoms that could lead to suicidality. And analysis of the data will be reviewed on a t-test because there are only two variables being analyzed: the independent variable, which is the CBT intervention, and the dependent variable, which is suicidality. Thanks for watching.